So that didn't work. If you were on our previous link, I again wanted to try something new. It didn't work out. So I'll give people a few seconds to jump on here um, so we can pick up our conversation. I will try again to, oh, well, actually, now that that other segment is done, those slides and that little 20-minute chit chat will be on our page shortly. So not to worry about that. I will definitely make sure that is available to you guys. And I'm going to pick up with a few additional questions that were sent in for us earlier in the week. Okay, so I think we talked about this already, but we had a question after last week's session about I've been home for a week already and we're still having more cases. So what's happening with that? So this, now that I can't share my screen, I'm not going to try to go back to the slides, but before we were talking about how it takes a few weeks before someone who's infected has enough antibodies, enough immune response to clear the infection, but that during that period of time they are potentially contagious. So remember that when we're making interventions now, what we're doing is we're making an intervention for the future, for those next 2 weeks or next 3 weeks, even in terms of when spread happens. We're decreasing spread for weeks in the future. So staying home today doesn't mean that then tomorrow the cases are all of a sudden going to drop off. The things that we're seeing today are results of things that we did or didn't do 2 or 3 weeks ago. So keep that in mind. So I say that to say stay the course. Um, this is one of the things that humans and animals in general are not good at doing, is to make decisions for the future. But keep your social distancing going. Pay attention to what your local recommendations are as well. And another few weeks of this, and we should be able to have some improvements. Excellent question. I'm going to click on this and see what's happening here. Oh, got it. Okay, sorry. I thought I could see some more questions up there, but I cannot. Oh, here we go. All right, so we have some more questions from the direct messaging. Should there be concerns for women that are pregnant during this time? Should they avoid doctor's appointments to prevent exposure? Is the baby at risk at all? Thank you for that question. And the fact is, we don't know. In general, you don't want to have new infections during a pregnancy. So this would be, I would say that during pregnancy, in general, you don't want to get new infections, because when you are exposed to a new infection, your body is in the process of fighting that infection. Sometimes you get a lot of inflammatory mediators. You can get into a high inflammatory state when that happens. And lots of inflammatory mediators are not always great for growing babies. So I would say that in general, aside from coronavirus, keep during pregnancy, trying to keep yourself, relatively isolated, and definitely not around, people who are sick, known to be sick, is good advice. And avoiding doctor's appointments to prevent exposure. So we had a question like this last week as well. What I would do is call your GYN's office, your OBGYN, and see what they're doing. So a lot of offices are doing FaceTime visits. There might be some things that you're able to do remotely with your doctor's office in terms of sending in your weights or sending in your blood pressure. So I would definitely call the doctor's office before you show up for a routine appointment. Of course, if you're going in with a concern, they always want to see you if you have a concern. But if it's a routine checkup, I would definitely call first and make sure they want to see you in the office. And then if you do have to go to the office, just do your best to decrease contagion. So this is not the time to, maybe put your spoon from your yogurt on the countertop and resume eating when you're done. So just being extra cautious about your surfaces, about hand washing, and keeping your distance even in the doctor's office. Excellent question. And then the baby. So actually, I'm going to tie in this question to another question that I wanted to bring up that we got in a direct message from last week. So the numbers of people that were pregnant during the Wuhan outbreak. So that's right now the largest cohort of people that we have information on about the coronavirus. So the number of pregnant women during that outbreak that we have numbers reports on terms of how they were doing is quite small. They had, I believe, three that were reported, and they reported that the babies did fine and did not have any complications. The additional question that I got that's similar to this is from Lori and Doug and Pascal, who's almost one, from last week, and they were asking, is coronavirus in the breast milk? So again, this is a very small number of people that we have studied so far, but we do have one report out of, this was in the Lancet, but I believe this was also from Wuhan or Hubei, another province that had a large outbreak. So they had a baby, a 55-day-old baby that was infected and was sick in the hospital, and they had lots of opportunities to collect specimens and samples. And they collected three samples from mom of breast milk, and they tested for the virus in the breast milk, and it was negative on all three samples. So for that one patient, remember, so this is not a large, when we give recommendations in general, we like to have studied a large number of people, and we want the results to be, we call it generalizable. So not just one person that could have been a fluke, one way, yes or no. But in the one patient that we have report on so far that they tested the breast milk, we did not have a evidence of the virus in breast milk. So in terms of what we think in risk for the baby, for the small numbers that we've studied, we think it's low. And also, again, for my question from after the session last week, we don't think it's passed in the breast milk. So thank you. Excellent question. Okay, should I get a flu shot? I love the flu shot. I, again, this is my personal and professional bias because I take care of kids that are sick enough to be admitted to the hospital, and anything that we can do to prevent kids from getting admitted to the hospital, we like to do. So I highly recommend that all of our eligible patients get the flu shot every year. In addition to protecting yourself, or I would usually say giving your body a head start. If you do get exposed to the flu, you kind of have a little head start, some antibodies on board. By you getting your flu shot, you're also protecting other people in your community that cannot get the flu shot. You're increasing the herd immunity so that in general the flu doesn't spread as quickly when it comes around to flu season. So for coronavirus in particular, this is not an influenza virus, so there's no benefit specifically from getting the flu shot for this particular virus. But viruses a lot of times travel together, and what you definitely don't want to do is have the flu and coronavirus at the same time. So yes, if your doctor still has influenza shots available from the beginning of the season, I would recommend that. And we're getting ready to come up to flu season again. So when flu season comes up again in the fall, I definitely would recommend to get your flu shot. Ooh, I love this one. This is from our direct messages. What's the best way to clean surfaces? So most of you guys, in the general cleaning products that you have in your house that have bleach is the one that we like to use in the hospital, in a lot of hospital settings. So bleach containing solutions, Lysol is an ammonia containing solution, I believe, but that is fine as well. As a matter of fact, somebody asked me, oh yeah, about making your own cleaning solutions at home, so I can talk to you about that as well. But yes, so I would say your standard cleaning solutions on the back of the bottle, or these days on the front of the bottle, it'll probably tell you that this, will kill 99.9% of viruses and bacteria. Those are all sufficient. Follow the instructions on those. Most of those products, you use them wet, but they have to be allowed to air dry. So you don't necessarily want to use the product and then go over it with a dry rag and dry the surfaces. The product actually needs to be wet to interact with the substance that you want it to attack, and then in the time it takes for it to dry is the time that it's actually working. So you definitely don't want to dry those surfaces off before, just let them air dry. In summary, just let them air dry. If you don't have any kind of the bleach containing solutions, if you have regular 5%, 6% bleach at your house, the kind of bleach that you would use for your laundry and that kind of thing, you can dilute that to make a cleaning solution as well. It would be a quarter cup of your bleach to a gallon of water, and that will give you a cleaning solution that you can use in the same way. Again, and remember, of course, to use it with gloves. Bleach can be corrosive to your skin, so you want to be protecting yourself, and of course, protect yourself from splashes too when you're mixing. So make sure you're being mindful of that. And don't mix bleach and ammonia. So if you have an ammonia containing solution, a bleach containing solution, you don't want to mix those, and you don't want to mix bleach and vinegar either. So if you're going to use a bleach containing solution, which would be, it's my favorite. If you can stand the smell of bleach, it's my favorite cleaning solution. Then use the bleach solution, but don't mix it with other cleaning solutions. Okay, I have a couple more questions from last time. Okay, so remember now that at Easy Peasy we are here in Florida. I actually got a question about the pool and a question about the beach that I'm going to guess probably came from Floridians. So let's do the pool first. Someone asked, what about going to our community pool? Community pool. Mm. Okay, so now if your community pool is still open, I'm surprised. The water itself, if it's properly maintained, properly chlorinated, and the pool is properly cleaned, the virus itself is not going to be in a properly chlorinated pool. However, at your community pool, there's a lot of high touch surfaces. So the rail that you're going to hold when you're walking down into the pool, the plastic chairs that are at the pool, those are surfaces that can hold the virus. So I think it's nice if your community pool is open. My preference probably would be maybe not, maybe not right now. The pool water itself is not going to be the problem. It's going to be all the things you have to touch to get into the pool, including the handle that you're going to push or pull when you go in, the door knob, if the gate is if the pool is gated or protected, that little thing you have to pull up at the top in order to get into the pool. So those are all high touch surfaces. And, at the community pool, you're not just talking about things that people in your own family have touched, but it's open to the whole community potentially. I probably would try to limit those exposures. All right. And the beach. So someone asked me about the beach last week. Again, I'm pretty sure it was probably a Floridian that asked me that. So I will give you a mixed answer about this. So we, first of all, here in South Florida, I'm pretty sure our beaches are closed now, and which makes me sad. Even though I'm laughing, I'm laughing because I'm sad. But for my friends that are, say, in New England or Californians that like to hike when you guys have some downtime and when you want to relax, you need some fresh air. So for people who grew up here in South Florida and who live here in South Florida, walking on the beach is kind of our equivalent of taking a hike if you are, a person who lives in a place where you guys hike. So on one hand, I like the idea of going outside for fresh air, for just kind of a chance to get some sunlight, just get out and stay socially distanced. The challenge for us here in South Florida, especially, is that we had lots of people from out of town that were not socially distancing at the beach, and were actually probably sharing a lot of we call them fomites. Fomites are things, usually hard things, like say your pen, for example, or like things that can hold the virus on a surface. So your beach ball, your volleyball, your cooler, if you're taking a cooler to the beach and sharing with a bunch of friends. So if you're at the beach and you're not socially distancing, then that's just another opportunity to share germs. If you go to the beach by yourself, or say with your small family unit, and you guys are there with your own supplies from home, your own cooler, your own food, and you are not touching the high touch surfaces, which at the beach probably would be, I guess, maybe the shower handle. I think that the beach would be a fine outing. That's my personal opinion. But again, here in South Florida, I'm pretty sure most of our beaches are closed. But if you have an opportunity to get a walk in on the beach, I would say take it. Stay socially distanced. Don't. This is not the time to run your hand along the boardwalk as you're walking down the beach. Keep your hands to yourself. Keep your socially distance, and just enjoy the beach without the beach balls and the party. This is the time to kind of do your alone time. Okay. Oh, excellent question. So I have a question about so for people my age, managing your parents. So people in the middle are kind of managing the kids and managing the parents. Okay, so my almost 80-year-old parents are stir crazy. For the most part, they're sheltering in place. They are taking walks outside, but they typically drive downtown to walk there. Is that okay? They are keeping 6 feet away from people. I love this question. And yes, I am okay with that. I do think it's important for people to get out. And when you're sheltering in place, you definitely can get stir crazy, and it's important to get fresh air. I thank you for the question. And what I would encourage the parents to do, and this is the same thing I tell my parents, is just be extra cautious when you're out. Again, this is not the time to touch all the surfaces. Try as much as possible to keep your hands to yourself. Wash your hands when you immediately, or if you have hand sanitizer, take it out with you and clean your hands frequently as you're out and about. And of course, when you get access to soap and water, wash your hands when you're back in your home. Um, this would not be the time to necessarily eat at a restaurant or kind of go into a crowded coffee shop or anything like that. But if you're walking and you're maintaining your social distance, like it says your parents are, I support that. The other thing I thought about is I don't know if you guys have been a part of any of those live DJ parties on Facebook and other social media. I kind of love that. So if you can find one of those stations with music that your parents love, um, I know someone in particular, my brother, DJ Spencer Steele, has been doing some different mixes from different decades to kind of keep people entertained and when you're at home. So finding some cool social media stuff that they can be a part of when they're at home might also help them when they're in the house. But I do support taking walks and being careful. Excellent. Alyssa, hello. All right, here we go. So I have a couple more questions here. We talked about the pool, we talked about the beach, we talked about the breast milk, and then someone asked me again on pregnant women and newborns. So we kind of talked about this already, if there was any updates. So I haven't seen anything yet in terms of any getting more a larger denominator or more information on pregnancy and newborns. We already did the update, I think, in the previous segment about the one study that we had, a 55-day-old baby that that was admitted to the hospital, and this is a baby that was in Wuhan, and they checked the breast milk several times and they did not find any shedding of virus in the breast milk. But again, that's one patient, so that's encouraging, but we need more information on that. So to be continued, and when we have more information, we're happy to share that with you guys as well. I think that's all I got. Last week we had questions about emergency medication. So again, if you are on any daily medications, making sure that you have refills of all of them. And if you have any emergency medications that go along with your daily medications, make sure you have your emergency meds as well. Your EpiPen, your Benadryl, your albuterol inhaler if you need that. So make sure that you have all of those things as well. Wait a minute. My friend asked me if I brought the tape. Always. I always have the tape. All right. I will talk to you more about that later. I have another story for you. Okay. So I think that's pretty much all the questions we got. Let me just go through again and make sure I answered all these questions. Feel free to DM us. Let's see here. Feel free to, DM or send us additional questions as well. You can personal message me as well. We have one additional question from our Easy Peasy account. How long do I think we will need to self-isolate? I don't know the answer to that question. And of course, so on the Facebook is, a national, international forum. So every area is going to be different in terms of how the spread is happening in that area. So if you're in an area where the peak has already happened and you're kind of now starting to wane down with new cases, then that might be a time when your local officials might say, okay, we don't have to self-isolate as much. So again, this would go back to that part of the slides that we were doing before that would say, listen to keep up with your local officials and recommendations, because the answer to that question will vary from place to place depending on how the spread is going in your area. But one of the things I can say is that um, the more people that socially isolate, the better we'll do. I'll make sure that that video that my friend sent to me from New Zealand that shows the nodes from the spread from person to person and what happens when you don't when you socially distance and don't take the virus with you to the cookout or to the airport. So the longer we do that and the more people that do it, the kind of the more flat that curve is going to be. When we talk about flattening the curve, the fewer people will be infected at the same time, and the faster this will get better. So we kind of need to, as a team, stay the course and try to socially isolate as long as we can, especially when we're on the rise in terms of the number of cases in our area. That's a great question. All right, I think we're good then. I think we did all of our old questions from last week and the new questions from here. So again, thank you guys for your time and attention. If you didn't catch the last one with the slides and a little bit of the video, it was a little bit different. We did it different than we did last week, but I guess now we can compare, see which one we like better. So you can send us some feedback on that as well. But that other, the replay of that other video should be up pretty soon as well. So take care, you guys. Stay safe, stay healthy. Thank you to all of our workforce members who can't be at home. So that's like our medical professionals, our grocery workers, our daycare workers who are still taking care of kids who can't be at home with their parents. So critically needed families are still taking their kids to daycare. We appreciate that. Of course, all of the drivers out there who are making sure that we get our deliveries, UPS and USPS, Amazon, FedEx. Thank you guys for keeping us all sane in our own homes on our socially isolated days. And even for those of you that have to go into work, make sure that you're doing as much social distancing as possible when you are on your downtime. So lots of good hand washing and not too much public interaction and sharing of fomites, etc. All right, you guys, take care, be well, and we will chat again soon. Bye.